Now, the second thing I had to determine is, okay, inflammation is the common denominator that is in all the causes, all of those symptoms that I mentioned. And then I had to figure out really why all of these different symptoms are associated with inflammation in the joint. I recalled something that I learned from my orthopedic colleagues at Vanderbilt when I was in medical school and surgical training, and they called it joint splinting. Let me explain what joint splinting is, and it affects each and every joint. If you have a bad elbow, let's say tennis elbow. Where I come from, we don't have tennis elbow. We didn't have anybody that had enough money to play tennis, but we had a lot of people who played bingo. So where I come from, the little ladies would sit in the churches at night with about 20 bingo cards in front of them, and they go like this up and down, those cards, for about 2 or 3 hours. And believe it or not, they would develop what the orthopedic surgeons called and laughed at bingo elbow, but it was synonymous with tennis elbow, which is overuse of the joint. When this joint becomes overused, it becomes damaged, and as we determined, damage causes inflammation. Now, the orthopedic surgeons know all about this, and they know about the phenomenon of joint splinting, and here's what joint splinting is. When you have inflammation in a joint, a signal goes up to the brain or central nervous system that tells the brain there's inflammation in this joint. It goes by what we call autonomic nervous system. That's a nervous system you're not aware of. It's functioning 24/7. It's keeping you breathing. It's keeping your heart going. It keeps all your bodily functions going. That's the autonomic, if you prefer to call it, automatic nervous system. But it's the nervous system that's always functioning. It tells things how to move and how to work. So the signal goes up to the central nervous system and says, don't move that joint. Or it goes up to the central nervous system, says there's inflammation, and then the central nervous system sends down a signal to the muscles on either side of the joint and says, do not move that joint. That is the phenomenon of joint splinting. When I recalled that, I thought, wow, I would bet that same phenomenon works with the jaw joint. And that's actually what I found to be true. When you have inflammation in this joint, the signal goes up to the brain and it says there's inflammation in this joint. The brain, or central nervous system, sends back a signal that says, okay, don't move the joint. And the muscles on either side of the jaw joint get tight and they cause pain, but not in the muscle themselves. The pain is associated with where the muscles are attached to the bone. So the patient will come in and they will complain of aches and pains where the muscles attach to the bone. And those places, there's several large jaw muscles, we won't give them the big names, but they're attached to the side of the head, they're attached under the jaw, they're attached inside in front of the ear. There's even a big muscle that's attached under here. And those patients will come in and say, doctor, I have a headache, but it jumps around. Some days it hurts here, some days it hurts here, some days it hurts here. Now, if this process goes on, and it is a process, and it continues on for any length of time, and as I said, I have many patients who have this problem for going on 30 years, eventually the signal goes up and it says, it's still hurting. I don't care how much you tell me not to move the joint, it's still hurting. So the central nervous system sends back a signal and said, okay, I told you don't move the jaw. Now what I want you to do is don't move the entire head. And the signal comes down to tighten the muscles that move the head. And those muscles then get tight and they pull on the bone, and where those muscles are attached to the bone, it's going to create pain. And the patients will come in and they will point specifically to the areas where those muscles are attached, and they'll say, I have neck ache every morning and it hurts right there, doctor. Well, that's where the sternocleidomastoid is attached to the back of the skull. Or they say, you know, it hurts right over here, or the trapezius on the back of the skull. And they will point exactly to those muscles, and some of these people have neck pain for 5 years, 10 years, 20 years that doesn't go away. Now, if this process continues to go on, the brain will send down a signal to not just tighten the jaw, not just tighten the head, but to tighten the entire upper shoulder girdle. And when it does that, it activates muscles on the side of the neck of which there are nerves running between the muscles that go into the arm, and those nerves will cause pain and even numbness of the arm all the way down to the fingers. So the phenomenon of joint splinting runs something like this. You have an inflamed temporomandibular joint. You have what we call afferent transmission, the transmission of the autonomic nervous system into the central nervous system, so there's inflammation in this joint. Then you have transmission of the efferent nervous system from the central nervous system out to the muscles that move the jaw and make them tight or rigid. We call that trismus. And then you start to get, as patients say, migraines. Migrating migraines. Now this is just a diagram showing the area of which I'm speaking. This is the ball in the socket. When this becomes inflamed, as I said, the inflammation triggers a signal that goes up to the central nervous system brain. Brain signals don't tighten those muscles, don't move the jaw. The signal comes back down this side through this set of nerves, and it goes to these muscles here, and it says, tighten the jaw, and it will hurt there, and there, and there, and there, and especially where this big muscle, this is just half of it, is attached to the side of the skull. They'll point right to the top of the head, and they say, 3 times a day I get a headache right to the top of my head. And that's the temporomandibular joint headache, extremely common. This is a diagram that I explained to you as the muscles on the side of the skull in the neck. When these muscles are sent a signal to get tight, they're like little fingers that sit on the side of the neck. The nerves that go through those muscles are called the brachial plexus, and the brachial plexus supplies the muscles of the entire lower arm. And when those muscles get tight, it squeezes the nerves of the brachial plexus, and then you start to have arm pain and numbness.